So in this lecture series, we are going to learn about torticollis. Torticollis basically means SCM tumor. Okay, but this is not actually a tumor. It's actually a fibrotic nodule. It is a fibrotic nodule which is present in the sternocleidomastoid. Now, whenever you learn about torticollis, the most important thing that you need to remember that this is also known as wry neck. This is also known as wry neck. Okay. Now there are different factors that are associated with torticollis. So one is congenital. Congenital, it's a congenital wry neck. It's a congenital wry neck. Okay, congenital wry neck. Secondly, it's the acquired. In the acquired condition, it might be because of certain vision problem. Certain vision problem. Basically, if someone has squint, so to compensate for that squint, he will turn his head. Okay, that usually happens in the case of your paralytic squint. Okay, in the case of paralytic squint. Okay, now this is a neuromuscular disorder. This is a neuromuscular disorder. Neuromuscular disorder. Okay, so the head is bent in such a way that, suppose if this is your head, okay, this is your head, the head will be bent. Suppose this is your sternocleidomastoid, one sternocleidomastoid. If this is fibrosed, the head will be turned to this side, and the chin will be turned towards this side. So chin will be turned to the opposite side. Okay, and the head will be turned towards the affected side. Okay, so sternocleidomastoid, so this might be usually due to the birth trauma. Okay, birth trauma. So what happens during birth trauma? Due to sudden constriction of the muscle supplying sternocleidomastoid, there will be ischemia of the sternocleidomastoid, and that will lead to basically fibrosis. Now that fibrosis is more common if you look into the junction upper two-third and lower one-third. At this particular junction, upper two-third and lower one third. Okay, so at this particular junction, the fibrosis is most prominent, and clavicular head is the most commonly affected area. It is more common to the right side. Okay, now what you need to remember here is the baby will acquire neck holding. So from your pediatrics, you know that the baby will acquire neck holding at the age of 3 months of age. Okay, at the age of 3 months. So this torticollis is also actually appreciated at the month of 3 months. Okay, so parents, by examining this SCM, they look at the fibrotic nodule and they become very much scared. That whether this is a tumor or not. So they come to the orthopedics department. They come to the ortho department, or they come to the pediatrician, and you should actually counsel the patient to go for conservative management. Where what will you do? You will actually ask the parents to actually slowly turn the head of the child to the suppose towards the affected side. Okay, so the chin is tilted towards the normal side. Okay, so you just tilt the chin and you try to do exercise. Okay, ask the parents to help the child to do the exercise. If in case the child, if this is not treated, later the child might land up to plagiocephaly. And this kind of deformity is actually known as cock robin deformity, cock robin appearance. Okay, cock robin, it's a bird. Okay, it's a bird, cock robin bird appearance. Okay, I will show you the picture. Now what you need to remember is the birth trauma. It happens due to breech baby, or it might be due to shoulder dystocia, or it might be due to intrauterine packaging defect. So what happens in this one, intrauterine packaging defect? In the case of DDH, in the case of torticollis, in the case of metatarsus adductus, this is just an example I am giving you. But in the case of any intrauterine packaging defect, any intrauterine problem leading to orthopedic problem, maybe CTV, maybe DDH, maybe torticollis, this will manifest. Okay, this will manifest. Now what you need to remember is, If in case it doesn't treat by surgical method you are going to go for a, sorry, conservative method, you are going to go for a surgery. For the surgery, what you will do, you will actually release the fibrotic band. You will release the fibrotic band, okay, and then you will keep it in a callous cast, okay, for 1 to 4 years, okay, for 1 to 4 years. This was about torticollis. Let me show you the picture. See here, this is known as a cock robin appearance, okay. So this bird is, is tilting his head, and this is known as a cock robin appearance, number one. Number two, you can see that this is a congenital muscular torticollis. The chin is tilted to the normal side, whereas